It's Dr. Charles with Active Life Chiropractic in Rapid City. We're going on that continuum. So we talked about normal tissue healing timeline, muscle healing. Now we're on to ligaments. So when we look at ligamentous injuries, it's going to be that same concept of you have inflammatory phase, proliferation phase, and maturation phase. With a ligament injury, 0 to 3 days or roughly 48 to 72 hours after the injury is going to be that inflammatory phase. You know, that's where it's going to be red hot, swollen, kind of causing some aches and pains, pain with weight bearing. As we progress here into the proliferation phase, it's going to be that 3 days to 6 weeks and then on to maturation. So in maturation phases, this can be that 5 weeks up to 50 plus weeks, or over a year for actual mature ligamentous healing. That's one thing to keep in mind. So if you had a ligament injury, whether you had it operated on or rehabbed yourself, we don't want to follow the numbers in the research to say when you can go back to activity or when you can go back to sport. We want to measure objective findings for you, whether that's stability, strength, or muscle endurance, so we can protect that joint so those passive tissues can be loaded appropriately. So similar to muscle strains, we have ligament sprains. We're going to have 3 grades of them. The grade 1 is going to be that, roughly the 0 to 3 days of healing. At that time, it might be a little irritated, but there's no tears or ruptures of that ligament. Next, grade 2. This is going to be a little higher grade, obviously grade 2 ligament injury, and that's going to be, partial tearing of that ligament. So some fibers are actually torn and injured, so that's going to take, a little longer to heal, that 3 weeks up to 6 months of healing. And lastly, grade 3 or complete rupture. Those ligamentous fibers are no longer together. They are torn completely. And that's going to take 5 weeks up to a year to actually heal those fibers together, whether you had it operated on or had some sort of pain management or regenerative medicine healing in those structures. So as we go over here at this knee injury, everything in blue are going to be your ligaments. This is a right knee if we're facing it anteriorly. And on here, when we have ligaments, we need to increase stability through the muscle activation around the knee. So that's gonna be your quads, your hamstrings, adductors, anything that we can create stability. So that's just showing, the 4 main ligaments, the ACL, PCL, MCL, LCL, just around the knee. And then lastly, if you're gonna have a ligament graft, that's going to take even longer to heal. There's actually an operation happening, so that's going to be roughly 2 months to 2 years of healing journey to start increasing load to feel your best. So if you have a ligament injury or dealing with a sprain, visit activelifesd.com.